What are heart rhythm disorders? Heart diseases are one of the most common health problems in society. Cardiovascular diseases are among the leading causes of death due to health problems in the world. Disorders that occur in the heart can seriously negatively affect people's quality of daily life and can lead to serious clinical problems that can be life-threatening. Heart rhythm disorders are one of the most common heart diseases in society. What are heart rhythm disorders? The heart is an organ that works by regular contraction through electrical activity in specialized cells in its tissue. In a healthy individual, the heart beats in a certain order and speed, fulfills its physiological functions, and provides the blood circulation necessary for the body to survive. However, if the heart goes out of regular rhythm for various reasons, disruptions occur in the blood pumping function, preventing healthy blood circulation. This condition is called arrhythmia or rhythm disorder. Rhythm disorders occurring in the heart are divided into different types depending on the way the heart rate is affected or the beats become irregular. Types of arrhythmias can be classified as follows: bradycardia. It includes rhythms in which the heart rate is slower than normal. In this regard, bradycardia is mentioned when the heart beats less than 60 beats per minute. Tachycardia. Tachycardia is defined as a rhythm in which the heart beats faster than normal. More than 100 beats per minute indicates the presence of tachycardia. Premature beat. It is a condition in which the heart beats earlier than normal, incompatible with the regular beat. Irregular beat. It is the state of irregularity in the way the heart beats. In particular, irregular beats called fibrillation that do not provide effective heart contraction are examined under this heading. What causes heart rhythm disorders? Heart rhythm disorders may occur as a result of physiological conditions, environmental effects, or some health problems that negatively affect the heart muscle tissues responsible for the electrical activity of the heart. Heart rhythm disorders may be observed in the following situations: genetics. Some genetic factors prevent the heart muscles from working under physiological conditions, causing congenital arrhythmia. Anatomical problems. Some tissue parts that develop outside the healthy anatomy of the heart may invite serious rhythm disorders. Heart diseases. An important cause of rhythm disturbances is heart diseases such as narrowing of the heart vessels, complete blockage, deterioration of heart valve functions, heart failure, inflammation of the heart muscle. Lung diseases. Heart rhythm disorders may occur in the course of problems such as infections in the lungs or clots in the lung vessels. Infections. In infections that occur in the body, heart rate increases and arrhythmia may develop due to high fever and dilation of blood vessels. Pain. In patients with severe chronic pain, there may be changes in heart rhythm due to activation of the nervous system. Stress. In cases of intense stress, depression, or anxiety, the heart rhythm may be negatively affected. Fluid loss. In patients who suffer from severe fluid loss due to various reasons, such as diarrhea, exposure to heat, vomiting, the pumping function of the heart may be impaired and rhythm disturbance may occur. High blood pressure. When blood pressure becomes too high, arrhythmia may develop as the heart becomes difficult to contract. Allergy. In severe allergic reactions, blood vessels may dilate, causing a serious decrease in blood pressure and disruption of the rhythm functions of the heart. Thyroid diseases. Heart rhythm disorders may be observed in the course of thyroid diseases that result in more or less than normal thyroid hormones. Kidney failure. With serious deterioration of kidney functions, minerals such as sodium, calcium, and potassium in the blood go beyond their normal limits, which can directly affect the heart rhythm. Diabetes. In diabetic patients, both disruption of metabolism due to irregularity of blutzugar and problems in the distribution of blood fluid and minerals can affect the heart rhythm. Anemia. In case of severe anemia, the electrical activity of the heart is also negatively affected because sufficient oxygen cannot be provided to the tissues. Sleep apnea. Short-term cessation of breathing during sleep reduces the amount of oxygen in the tissues and can lead to arrhythmia by disrupting the contraction function of the heart. Substance use. Smoking, alcohol, or use of certain drugs may negatively affect the heart rhythm and cause arrhythmia. What symptoms do heart rhythm disorders cause? Heart rhythm disorders occur in different ways depending on the underlying cause. In this regard, in some rhythm disorders, since the heart's blood pumping function is seriously restricted, serious clinical symptoms or life-threatening situations may occur. Some arrhythmias may have a benign course with some symptoms in patients without affecting the contractile function of the heart. In this regard, the following symptoms may be observed in patients with rhythm disorders: palpitation, discomfort in the neck or chest, palpitations, heart beating fast, chest pain, shortness of breath, weakness, fatigue, dizziness, fainting, cold sweat, fear of death, severe anxiety. In cases that disrupt the contractile function of the heart, patients may experience general deterioration, confusion, or loss of consciousness, as well as complete deterioration of heart functions. How to diagnose heart rhythm disorders. The most commonly used method for detecting heart rhythm disorders is electrocardiography, or ECG, after the patient's history and physical examination. Thanks to ECG, the electrical activity of the heart can be directly examined, and the changes in activity can be followed instantly. However, 24-hour examination may be needed in some patient groups who experience short-term rhythm disturbances during the day and then return to normal rhythm. In these patients, Holter examination, which can also be evaluated as a 24-hour ECG, is used. In addition to these examinations, echocardiography, EQ, stress test, X-ray examination, and blood tests, which enable the examination of the contractile function and anatomy of the heart to detect conditions that cause arrhythmia in the heart, are frequently used. What to do in the treatment of heart rhythm disorders? It is essential to correctly identify the underlying cause of arrhythmia in eliminating heart rhythm disorders. Treating the underlying disease often ensures the termination of the heart rhythm disorder. However, in some rhythm disorders that can be life-threatening or cause serious clinical deterioration, medical treatment is often used to ensure that the heart rhythm returns to normal. In fast rhythms, also known as tachycardia, drug groups called antiarrhythmics are used to slow down the heart and return it to a healthy rhythm. In some rhythm disorders seen in the course of heart diseases, such as heart attack and heart valve disorders, it is necessary to make the heart vessels functional again or to correct the valve problem. In life-threatening cases such as ventricular tachycardia or ventricular fibrillation, electroshock therapy may be required. Due to the insufficient pumping function of the heart in the course of rhythm disorders, the risk of intravascular clotting in the circulatory system increases, and the risk of clots being thrown to other organs, especially the brain. For this reason, blood thinners may be used in the treatment of some arrhythmias,